Hello and welcome. You're watching Health and Wellness, and the focus of our episode today is on saving a life. Now imagine a scenario where someone or a loved one suddenly collapses in front of you after a cardiac arrest and you can't do anything as you don't know the basic first aid. According to the WHO census statistics, mortality due to cardiac causes has overtaken mortality due to all cancers put together, and approximately 4,280 out of every 1 lakh people die every year from sudden cardiac arrest in India alone. Now, the good news is that lives can be saved. It has been proven that by standards, CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease. Research reports that a majority of cardiac arrests take place at home. CPR knowledge will equip you with the skill and confidence needed to transform yourself from the role of a bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the job and the role of CPR to revive and save a life. Thank you so much, doctors, for joining us. We're joined by Dr. Sharat Vijapur, a chief interventional cardiologist, Secure Hospital, Hubballi, and Dr. Vithal D Bagi, senior consultant and interventional cardiologist, Apollo Hospital, Bengaluru. We also have Dr. Mohammed Sadiq Azam, senior consultant and cardiologist, also joining us on the program. Well, Dr. Vijapur, I'd like to start with you. Cardiac diseases are now recognized as the #1 cause of death in India. What, according to you, is the reason for this? And are Indians, more prone to heart emergencies?
Yeah. As you know, Indian population suffer a heart attack at least 10 years prior to the Western population. This is mainly because we Southeast Asians have a genetic predispositions to heart diseases. This genetic predisposition leads to increase in chances of increased metabolic syndrome like diabetic, hypertension. We suffer a lot compared to the Western populations. And nowadays, we are seeing younger populations have change in their lifestyles, like they are more prone for stressors and they have more sedentary lifestyle, which has led to increase in chances of getting diabetes, hypertension, and increased consumption of alcohol, increased smoking, which all leads to increased chances of having a heart attack at an earlier age.
All right. Now, Dr. Bagi, a sudden cardiac arrest is an enormous healthcare challenge, and it's also a condition that is commonly misunderstood. So let our viewers know what exactly sudden cardiac arrest is and how is it different from a heart attack?
Cardiac arrest occurs when the heart stops pumping the blood, circulation stops, normal breathing stops, and the consciousness is lost. Cardiac arrest can happen in a person who may or may not have been diagnosed with heart disease. It can come suddenly or in the wake of other symptoms. Cardiac arrest is caused due to the malfunctions of the heart's electrical system. In cardiac arrest, death can result quickly within minutes. Cardiac arrest may be reversed if CPR is performed or a defibrillator delivers the shock and restores normal rhythm. Whereas heart attack happens due to the blockage in the arteries of the heart, which will lead to lack of blood supply to some portion of the heart muscle. During a heart attack, a person remains conscious, keeps breathing. Sometimes heart attack can lead to cardiac arrest.
All right, Dr. Vijapur, as the name suggests, it is sudden, but are there any signs and symptoms of sudden cardiac arrest?
As the name suggests, it is a sudden cardiac arrest usually occurs sudden. But before an arrest, if patient, like what has caused the arrest is the leading signs and symptoms. In case of sometimes heart attack can lead to cardiac arrest. That time patient might be having chest pain, breathing difficulty, or sometimes radiating pain to the left hand. Those are the symptoms of an heart attack, which ultimately sometimes lead to cardiac arrest. But before having a cardiac arrest, because of low blood pressure or decreased blood supply to the brain, patient might have fainting episodes or sometimes might have chest pain. These are the some of the symptoms which can occur prior to a sudden cardiac arrest.
All right, Dr. Bagi, if you could, tell us, you said CPR can save a person from sudden cardiac arrest. So how can we tell when a person is in cardiac arrest for the person as well as for somebody who may be there with them?
Yeah, for many people, cardiac arrest comes without any warning signs. Someone who is standing next to you, if suddenly collapses, suddenly becomes unconscious, unresponsive, if he's not breathing, you can check the pulse, no pulse is felt. That means he or she has already had a cardiac arrest. However, some people do experience some warning signs before a cardiac arrest. Those can be chest pain, dizziness, palpitation, fainting, or breathlessness. To recognize a cardiac arrest, if somebody suddenly collapses in front of you, just check his pulse if you are able to do it, or look for his normal breathing pattern. If he's not breathing properly, try to arouse him with shaking the hands or the chest. If he's not able to move and not able to respond, that means he has a cardiac arrest. Immediately you should take steps to do the CPR.
All right, so Dr. Vijapur, if you could, tell us more about how to handle someone going into cardiac arrest. What is the first thing that a person should do?
Yeah. First thing, as a bystander, when a person goes into a cardiac arrest, you see him, check for him and also the surrounding place. So if a person has sudden cardiac arrest and has fell in front of you, bring him into the safer place as soon as possible, if avoiding heavy traffic or avoiding heavy electric wires. And next thing, you have to see whether patient is having any injuries or a trauma. Next is whether he's really having a sudden cardiac arrest. That is he unconscious or conscious? Try to arouse him. If he is not arousable, then he is having sudden cardiac arrest. Then the next thing is you have to check for his breathing. Is he breathing or not? If there is a movement of his chest muscles or no. If he is not breathing, then you have to call first any bystander to help, one more bystander to help you, and call the emergency number so that the nearest ambulance team can arrive at the place. Next thing, you have to start CPR on him so that the heart muscles the circulation can be established by at least by CPR, and you have to deliver a rescue breathing for him. Usually CPR should be done around 100 to 120 per minute, and if you are alone, you have to do at least for 2 minutes. If anybody is there, you can take his help and he can do the CPR, and other person can do the rescue breathing. These cycles has to be continued at least for till the ambulance arrives at the place. Then the ambulance team will take over the CPR and this one, and the AED is there, they will take over the person with AED connected to him.
All right, we're also now joined by Dr. Mohammed Sadiq Azam, Senior Consultant Cardiologist, Mithri Hospital, Mehdi Patnam. Thank you so much, Doctor, for joining us. And a question to you, can someone who's already suffered a cardiac arrest then have another one?
Yes. It's a very pertinent question because many patients feel that, they've had a cardiac arrest and they've had especially in people who had a heart attack and who undergo revascularization either by an angiogram, angioplasty, they feel that, this cannot happen again. But that's a very big misconception because it can happen again. Especially we see this in people who have very low pumping of their heart, very low ejection fraction, so to speak. These people definitely they can have another cardiac arrest, and it's very important for such patients to be very vigilant to identify the signs and symptoms, especially people who have had heart attacks, who have not undergone revascularization procedures, who have not undergone coronary revascularization. These are the people who are at a very high risk to have recurrent cardiac arrest. This repeated cardiac arrest can also occur in people who suffer from arrhythmias. That is when the heart starts beating very fast. Normally the heart beats at around the rate of 70 to 100 per minute. But there are times when the heart is scarred, when the pumping is weak, when that same heart can start beating at 250, 300 times. So such patients, they require devices like implantable defibrillators to abort their episodes of sudden arrest. So yes, just getting a sudden cardiac arrest once doesn't ensure you from not getting it ever again. In fact, it puts you at a high risk group because you now become a resuscitated cardiac arrest patient and you can have a sudden cardiac arrest again. So it's important to understand why it happened and make sure that you go for regular checkups and maintain a healthy lifestyle so that your event doesn't recur.
Right. And Dr. Azam, we were talking about, first response to someone having a heart attack or sudden cardiac arrest. And if you can explain the things to keep in mind before starting CPR.
Yes, as sir was rightly saying, first thing is to identify correctly that the person has had a sudden cardiac arrest. See, not all falls are cardiac arrest. Sometimes you see in schools, especially, children are standing in an assembly for a long time. They feel giddy and they fall. But this is more of something that's known as a reflex syncope or a vasovagal syncope, where you stand for a long time, blood pools in the lower limbs, and then you have a drop. But then these patients, they don't lose consciousness typically. When you call them out, you sprinkle some water or something over them, they wake up. When a cardiac patient suffers a sudden cardiac arrest, he will just drop and he will not respond. So you need to call out to the patient. You need to try and, make sure that the patient is actually not responding.
All right, we'll slip into a short break now. Coming up on the other side, more questions to our doctors on first response to a sudden cardiac arrest. Stay with us. Welcome back. You're watching Health and Wellness, and today our focus is on saving a life and what your first response should be in case someone near you experiences a cardiac arrest. Let's go across to our doctors. Dr. Vijapur, heart attack and cardiac arrest are different. Should you perform CPR for a heart attack?
Yeah, as Dr. Vithal said, heart attack occurs because of sudden blockage of the coronary arteries. These are the arteries which supplies to the heart. Usually blockage of the arteries causes a heart attack. This heart attack is actually failure of the function of the muscles to pump the blood because of the blockage. So there is no stoppage of electrical activity when there is a heart attack. But in case of sudden cardiac arrest, there is sudden stoppage of electrical activity of the heart, which has to be reinstated with the help of a CPR. So CPR is usually not done in case of a heart attack. So, but patients with heart attack can go for sudden cardiac arrest in sometimes within a minute. So it is always be prepared whenever a patient with heart attack is there nearby. So whenever patients with heart attack goes for an unconsciousness, then the CPR is, that is if he enters into a sudden cardiac arrest, then CPR is indicated.
All right, Dr. Bagi, lack of CPR awareness is a big challenge in India. So tell our viewers why it's essential for people to learn CPR.
Okay. If CPR is performed immediately, it can double or triple the chance of survival of someone out of the hospital cardiac arrest. If the patient has a cardiac arrest in the hospital, most of the staff, they know how to do CPR. But here the point here is, if the patient has a cardiac arrest outside the hospital, so in a person who is having a cardiac arrest outside the hospital, if you do CPR, for him the chance of survival will double or triple. The brain can tolerate lack of oxygen supply or the blood supply only for a few minutes. After 9 minutes without circulation, the brain suffers irreversible damages. CPR, if you are doing a manual chest compression on the heart, it helps to keep the blood flowing, and it will help to minimize the damage to the brain, kidney and other organs. Sudden cardiac arrest is witnessed by a bystander in approximately 37% of cases. That bystander could be you. 70% of cardiac arrest happen at home, 20% at schools, and nearly 1,000 emergencies may come at workplaces. So CPR trained person can become a life savior at home, at schools, or in the workplaces. Fortunately, there are only few simple things you need to remember: how to do CPR, how to recognize a cardiac arrest, and you are able to save a life. And these simple steps they're quick and they're inexpensive. It hardly takes 30 minutes time for somebody to learn how to do CPR and how to recognize a cardiac arrest. So become a life savior at home or schools or sports ground or in the gym or maybe at workplaces.
Right, and how do you recommend people learn? Suppose, we have viewers right now who want to know about CPR. How do you recommend they learn? Should they just look it up, look at videos? Dr. Bagi?
Yeah, somebody collapses in front of you. What you need to see is, you look for the central pulses. If you are able to feel the pulse and patient not breathing, you can try to do a mouth-to-mouth breathing, or if you have ambu bag, you can put it on the mouth and do it. If pulse is not felt, the immediate step is you have to move it to a safer place, like Dr. Vijay told. He should not get injuries. So you should move it to a safer place as early as possible. Call for help, call for ambulance. And before the ambulance comes, you start doing the CPR. Like you have to give at least 30 chest compressions. You should be keeping the hand straight with the lower aspect of the palm on the chest, and continue to do CPR. You do 30 compressions and 2 breaths. And you can repeat the same cycle. If anybody is there to assist you, you ask him to do a mouth-to-mouth breathing or ambu bag breathing, and you can continue the chest compressions. You continue this CPR repeatedly till the person who had a cardiac arrest gets some pulse or gets some spontaneous breathing, or till the ambulance arrives. Once the ambulance comes, you can connect the patient to the monitor and see the rhythm. There are 2 kinds of cardiac arrest. One person may have a asystole. There is no cardiac activity. It is a flat line. You can able to see that the ECG is showing a flat line. That time we need to continue CPR, and we have to push some IV adrenaline and other medicines. Other way around, if the patient is having a ventricular tachycardia or the ventricular fibrillation, that means heart is beating at a very fast rate, around 200, 220. In that case, we can keep the defibrillator pedals on the chest, and we can deliver the shock, so which can revert the abnormal rhythm to the normal rhythm. So that is known as advanced cardiac cycle. Yeah.
Right. So, Dr. Azam, taking from there, how would a layperson know if he or she is doing CPR with the right technique, and what results from CPR should they expect, and how much time?
See, what as sir was just saying before me, first thing is you need to identify that the person has actually had a cardiac arrest. So you call out to him, see if he's responding or not. Make sure he's on a flat surface. Now, this is very, very important that you don't try to do CPR when the patient is on a bed, because you have a mattress that recoils. So when you compress the chest, the mattress recoils and your compressions are not effective. So put the patient down on the ground on a flat surface and just start compressing right in the center of the chest. You have both the nipples, the area right in the middle of that. That's where you have to compress. So the compressions should be with the heel of your hand, and you should not be bending your elbows. So the pressure should come from your shoulders. So you go up and down that way. And I always tell patients that, now the era of, even if you cannot give mouth-to-mouth breathing, or post-COVID, people are very skeptical to give mouth-to-mouth breathing. It doesn't matter. The amount of air in your lungs, the amount of air in your airway is sufficient for you to maintain oxygenation if you do good CPR, even for 3 to 5 minutes without giving respiratory breaths. So you can do good effective chest compressions and still manage to save the life even if you don't give mouth-to-mouth breathing. So don't let that deter you from doing it. So start compressions. I tell them do A, B, C, D, E, F, go till Z, again come back to A, and keep continuing it until you find a first responder or an ambulance that comes in. Then oxygenate the patient, if necessary defibrillate. Now there is something known as an AED, that is an automated external defibrillator. If you have gone to the airport, you would have noticed in the airports that there is this red box with AED written over there. I suggest everyone look up what an AED is. There are a lot of videos on YouTube. You should know how to work an AED, because if your patient is just dropped and you're not able to feel a pulse, it's better you connect the AED. The AED will tell you if it's a flat line, if there's an arrhythmia. If there's an arrhythmia, the AED will give a shock. If it's a flat line, the machine will tell you to start CPR. Now you can learn how to do CPR online, and there are a lot of hospitals, a lot of centers that conduct CPR courses. Now the aim should be every person in the family should have at least one CPR trained individual, and each one train one. If you are trained, make sure you train somebody else. There should be no family in the country that does not have a single person who is trained to do CPR, and that is the only way we can bring down the menace of sudden cardiac death. As for the end point, what do you look for? Well, your patient should regain consciousness. If your patient has not regained consciousness, continue CPR. you should know how to feel your central pulse. You should know how to feel somebody else's carotid pulse. If you're able to do that, continue CPR until you feel the pulse. If you're not able to feel, you've never felt a pulse before, don't go by the pulse. Look at the patient. If he's not awake, if he's still unconscious, please continue CPR until a trained person arrives.
All right, very important points to keep in mind. Thank you so much, doctors. And an important point that at least one person in every family should know how to perform CPR. Thank you so much, doctors, for being with us. And thank you all for watching at home. And I hope there's a lesson there for all of you. That's all we have today. Thanks for watching. Goodbye.